Hey, Dr. Sam here, helping you get closer to great skin days. Welcome back to my Acne Solved series. So, if you've been with me so far, you're on a structured plan, you're entering the second month of treatment, and you should be starting to see results. And by results, I mean the positive things you can see are fewer new blemishes and reduced intensity of blemishes, meaning they last for less time, which means less post-inflammatory pigmentation. The final upside should be an improvement in overall skin quality, increased radiance and clarity through the regular use of a retinoid or azelaic acid, which is your preventer step. Now, possible hurdles that you're encountering at this point can include things like purging and irritancy and slow response. So let's break those each down one at a time and talk through some tips for managing those problems. So let's talk about purging. Now, purging is the phenomenon that's probably experienced by around a quarter of people starting on their acne journey. Typically happens around weeks 1 to 4. And it's a consequence really of starting to get to the root cause of the problem, which is to unclog those pores and reduce comedone formation. But if you think about the lining of a hair follicle as a bit like a conveyor belt, in order to regulate what is coming through, you have to push out what has gone before, and that takes time. You don't solve acne overnight. I talk about 30% improvement at 3 months and 60% improvement at 6 months to patients to really manage expectations for the time course of improvement. It does not happen over hours or days, people. So around weeks 1 to 4, depending on how quickly you've been able to get into doing your preventer step every night, you might be experiencing some purging. And I think that's more common when you have lots and lots of comedone. So that can often be those individuals whose acne isn't even that noticeable because it's not terribly inflammatory. But when you look up close and when it's cross-lit, you can see a sea of bumps, those little block pores. But in a sense, they have to come out if you're going to move forward. So that's what you can sometimes experience. It can often grumble on for the next 2 to 4 weeks, sometimes even longer if you're taking a long time to get your retinoid usage up. The key approach here is to persist and to stay strong. For most, this is something that is transient and will eventually stop once the retinoid is doing its thing. Now, for some, the challenge can be if you can only use a gentle retinoid, your skin is sensitive, this period, as I say, can be quite protracted. If you want to reduce the intensity of a purge, I think the key thing is if it's really bothering you and you can't keep going, is to reduce the frequency of your retinoid use. So go back down to using it every other night or even every third night. Keep going though, keep going, persist, and eventually things tend to get better. So common problem number 2 is irritation. And I would say that anyone who is using the right strength of products for their skin is going to experience it. So you should almost assume that irritation at some point in time will be part of your journey because it tells us that we're operating at the threshold for what our skin will tolerate. So the way to manage this is to have various tricks up your sleeve to manage the dryness as and when it comes. Now, common sites for dryness, pretty much everyone using a retinoid will at some point experience dryness around their mouth, the muzzle zone, and occasionally around the eyes just because of the commonness of transferring a little bit of the active product across onto the eye area, perhaps when layering. It's just one of those things that sometimes happens. The key thing is not to freak out. So simple, easy fixes if things aren't too bad is just to up the ante with your moisturizer. So have something richer that you can potentially use at night. Maybe something richer that you wouldn't necessarily want to use in the daytime can create more space for your actives. Think about buffering, so perhaps have a lighter weight moisturizer that you layer underneath your actives to reduce the intensity as they penetrate into your skin. And then, of course, you can reduce the frequency and the quantity. So be comfortable altering the dial and reducing the intensity of your treatment as you go through this period of time with your skin. And remember that coming into winter, invariably your skin will be drier anyway, so be sensitive to that. And then that final consideration, slow response, which can of course be linked to irritation. If you can't escalate treatment as quickly as you would like, things may go slower than you'd like. And I think the battle here is a psychological one. Really appreciating that those goalposts of 30% improvement at 3 months really should help manage your impatience at this point in time. It really is key to get to that first 6-week marker, which represents one skin cycle, and then push through and keep going until you get to the next skin cycle marker at 12 weeks. So counsel yourself, be kind to yourself, and use your tools to increase the intensity of treatment as quickly as your skin will permit comfortably. So the take-home message today, guys, is keep on keeping on. We're going to get through these hurdles together, and know that you're building a valuable system for not only treating your acne, but preventing it in the future. I'll see you again in the next video. Bye for now.